the basic biology of sexual behavior. The evidence shows that gonadal steroid hormones play a powerful role in facilitating sexual behavior in both males and females. Males require the presence of testosterone and estrogen, whereas females require estrogen plus progesterone. The medial preoptic area and the ventral hypothalamus are the primary brain regions involved in the modulating sexual behavior. Androgens, estrogens, and progestins act at the genome to alter the synthesis of new proteins in brain which are thought to be responsible for changes in sexual behavior. However, non-genomic action of gonadal hormones are becoming more apparent. Studies using animal models have been instrumental in advising our understanding of human issues, such as androgen insensitivity, hormone replacement therapy, and treatment for hormone-responsive tumors in cancer patients.
The human sexual response cycle is the four-stage model of physiological response to sexual stimulator. In their currents are the excitement, later organs, and resolution phase. Sexual response cycle patterns of physiological events occurring during sexual oral and intercourse in both men and women. These events may be identified as occurring in sequence of four stages: excitement, play, orgasm, and resolution.
The diversity of sexual behavior. There are four types of sexual behavior: heterosexual, homosexual, bisexual, and transgender. Heterosexual is romantic sexual attraction or sexual behavior between people of the opposite sex or gender. Muna siya ang maibog sa dili niya kaparehas sa gender. Parehas paringlitan ng laki maibog sa bayi niya, bayi maibog sa laki. Homosexual is romantic sexual attraction, or sexual behavior between members of the same sex or gender. Muna siya po ang maibog sa kapwa ni mong ka-gender. Paringlitan, laki maibog sa laki. Bisexual is a romantic or sexual attraction or behavior toward both males and females, or two more than one gender. It may also be defined to include romantic or sexual attraction to people regardless of their sex or gender identity, which is also known as pansexual. Muna siya maibog sa kapwa nimong gender, then maibog po sa bayi. Transgender is someone whose gender identity or gender expression does not correspond with their sex assigned at birth. Many transgender people experience gender dysphoria, which they seek to alleviate through transitioning, often adopting a different name and set of pronouns in the process. Muna siya ang kanang laki ka niya, mag-pills mo, pills para matipuan ka, tutoy, malayong tingo, o muna siya. Thank you.
An erogenous zone is an area of the human body that has heightened sensitivity, a stimulation of which may generate a sexual response, such as relaxation, sexual fantasies, sexual arousal, and orgasm. Erogenous zones are located all over the human body, but the sensitivity of each varies and depends on concentrations of nerve endings that can provide pleasurable sensations when stimulated. The touching of another person's erogenous zone is regarded as an act of physical intimacy. Whether a person finds stimulation in these areas to be pleasurable or objectionable depends on a range of factors, including their level of arousal, the circumstances in which it takes place, the cultural context, the nature of relationship between partners, and the partner's personal histories. Erogenous zones may be classified by the type of sexual response that they generate. Many people are gently aroused when their eyelids, eyebrows, temples, shoulders, hands, arms, and hair subtly touch. Gently touching or stroking of this zone stimulates a partner during foreplay and increases the arousal level. Also, the gentle massage or stroke of the abdominal area, along with the kissing or simply touching the navel. The navel can be a type of stimulation.
Human sexuality refers to people's sexual interest and attraction to others. It is the capacity to have erotic or sexual feelings and experiences. Sexuality differs from biological sex in that sexuality refers to the capacity of sexual feelings and attraction, while biological sex refers to how many one's autonomy and physiology, hormones, and genetics are classified typically as male, female, or intersex. Sexuality is also separate from gender identity, which is a person's sense of their own gender and sociocultural classification. Sexuality may be experienced and expressed in a variety of ways, including thoughts, fantasies, desires, beliefs, and attitudes, values, behaviors, practices, roles, and relationships. These manifest themselves not only in biological, physical, and emotional ways, but also in socio-cultural ways which have to do with the effects of human society and culture on one's sexuality. Some researchers believe that sexual behavior is determined by genetics. However, others assert that it is largely molded by the environment human sexuality impacts and as impacted by cultural, political, legal, and philosophical aspects of life and can interact with issues of morality, ethics, the spirituality, and or religion. Sexual behaviors, the medial preoptic area and the ventral hypothalamus are the primary brain regions involved in modulating sexual behavior. Androgens, estrogens, and progestins act to the genome to alter the synthesis of new proteins in brain, which are thought to be responsible of changes in human sexual behavior. These are the actions that lead to reproduction and stimulation of sexual organs for satisfaction without conception. It can orientation, courting, sex positions, and genital reflexes. It also maintains social relationship and to make bonds for life in an animal population.
The world is already teeming with people today. Some countries have reached overpopulation and could not almost feed all the mouths of its countrymen. Overpopulation is now considered an international crisis, and it is not only the job of the government to tackle the overgrowth. As healthcare provider, we must be able to educate our clients on the methods of family planning that can immensely help the world in the control of the population. Contraceptives are products used to prevent pregnancy by women and men. Each individual has their own choice in what contraceptive they want to use, so you must assess their preference first before providing the best contraceptive for them. The methods of contraception, natural and artificial, are natural family planning, abstinence, calendar method, basal body temperature, cervical mucus method, symptothermal method, ovulation detection, lactation amenorrhea method, coitus interruptus, hormonal contraception, transdermal patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cap, male condoms, female condoms, surgical methods, vasectomy, tubal ligation. The reproductive system is our tool as humans to multiply or procreate. However, the earth would become unlivable if the growth of the population continues to boom. You have a choice among all the birth control methods, and these are only a call to be responsible parent and citizen.
The chemistry of lust, love, and attachment. The chemistry of lust, love, and attachment is a complex and dynamic process that involves the interplay of various hormones, neurotransmitters, and other chemical messengers in the brain and the body. Lust is often characterized by an intense sexual attraction and desire, and is associated with a surge of hormones such as testosterone and estrogen, as well as the neurotransmitter dopamine, which plays a key role in the brain's reward and pleasure centers. Love, on the other hand, is a more complex emotional and psychological state that involves feelings of intimacy, connection, and attachment to another person. It is associated with the release of hormones such as oxytocin and vasopressin, which are involved in bonding and attachment. Attachment is characterized by a deep sense of security and comfort in a relationship. It is also associated with the release of oxytocin and other hormones that promote bonding and trust. These chemicals work together to create a range of emotions and behaviors associated with different stages of a relationship. For example, the initial stages of attraction and infatuation are driven by the release of dopamine and other hormones associated with pleasure and reward. As a relationship progresses and deepens, oxytocin and other bonding hormones become more prominent, promoting feelings of closeness and attachment. It is important to note that chemistry of lust, love, and attachment is influenced by a wide range of factors, including genetics, upbringing, culture, and personal experiences. While understanding the chemical basis of these emotions can help us better understand our own experiences and behaviors.
Sexual self. Sexual self concepts refers to the totality of one as a sexual being, including positive and negative concepts and feelings. Sexual self is the negative perspectives on the sexual aspects of self and rules to the perception of a person as a sexual creature. It is the predictor of the sexual outcomes developed along with changes in sexual growth and experience. It is also concerned to analyze and to clarify concepts that one central in this area of philosophy: sexual activity, sexual desire, sexual sensation, sexual perversion, and others. It is also attempts to define less abstract concepts such as prostitution, pornography, and rape.
Female secondary sex characteristics. Secondary sexual development in girls involves the enlargement of the ovaries, uterus, vagina, labia, and breast, and growth of pubic hair. A discrete budding of the breast appears at first, usually follows a short-lived pivotal slowing in growth kinetics between 11 and 14 years of age. The typically adolescent growth spurt takes place and acne frequent. Initially, a small breast nodule is observed, followed within approximately 6 months by the appearance of pubic hair, and shortly thereafter axillary hair and progressive increase in her breasts. Size, sexual hair, and genital development, with the vaginal mucosa becoming more humid of a darker pink color and taking a secretory appearance with follow. The uterus increases in size up to stage 4 with the first menstruation occurs and the maximal growth rate is reached. Most girls may notch around 12 to 13 years old of age. However, occurrence may be as early as 10 or as late as 15 years of age in otherwise normal girls. First ovulatory cycles usually occur at a median age of 19 to 10 months after.
What are sexually transmitted disease? Sexually transmitted disease, or STDs, sexually transmitted infection, are infections that pass from one person to another through sexual contact. They are usually spreading during vaginal, oral, or anal sex, but sometimes they can spread through other sexual contact involving the penis, vagina, mouth, or anus. This is because some STDs like herpes and HIV are spread skin to skin contact. Some STDs can be passed from pregnant person to the baby either during pregnancy or when giving birth. Other ways the STDs may be spread include during breastfeeding, through blood transfusion, or sharing needles. There are more 20 types of STDs. One is chlamydia, genital herpes, gonorrhea, HIV, HPV, public lice, syphilis, trichomoniasis. What causes sexually transmitted disease? STDs can be caused by bacteria, virus, and parasites. Who is affected by sexually transmitted disease? Most STDs affect both men and women, but in many cases the health problem they cause can be more severe for women. If STD is passed to a baby, it can cause serious health problems. What are the symptoms of sexually transmitted disease? STDs don't always symptoms or may only cause mild symptoms, so it's possible to have an infection and not know it. And even without symptoms, this can still be harmful for and may be passed on during sex. If there are symptoms, they could include unusual discharge from penis or vagina, sores or what's on the genital area, painful or frequent urination, being itching under this and genital area, blister or sores in a round mouth, abnormal vagina odor, anal itching, sores or bleeding.